we're going to dive deep into time management and what you can do to make sure that you can consult within 12 minutes. Let's have a look at the common pitfalls. The first one is if you don't keep track of your time, if you haven't got a stop clock, then it's going to be difficult for you to know exactly where you are in the consultation. The other reason I have found is that if you're not priming your case adequately before starting the consultation, you're not going to keep up with time very well because it's going to take you longer to think through what you need to do next. Whereas if you have already primed your case, you prepare the case, then it's going to flow more effortlessly when you're consulting your patient. So when you are thinking through, it's very important to think about the potential diagnosis, think about how you're going to manage it as well. Don't just think, oh, you've seen that this patient has got headaches, so then you have a look at the note, that's it. But you need to think what kind of headache you might be encountering and how you're going to manage it. If you need to prescribe a medication, what medication are you going to prescribe? If you do that, then all this thinking that you've done is going to help you in the consultation. Not listening actively is another reason. If you're not listening actively to what your patient is telling you, then what happens is that probably you're not physically in the consultation. What happens is that you're thinking about the next thing, or you're just overthinking, and you don't really register what the patient tells you. And then what happens is that you might ask these questions again later, and it sounds like you haven't been listening. Another problem is lack of structure. If your consultation is not organized, then you won't have a good flow in the consultation, and it's going to take you longer if you're having to go back and forth. They also waste time in data gathering to the extent of procrastinating clinical management, so spending more time in data gathering and squeezing clinical management. So these are pitfalls that you need to be aware of and to avoid. So what are the reasons you're taking too long to elicit a history? Some registrars, their pace is too slow. If your pace is too slow, when you're consulting, you're asking question and then pause and then don't have a very good pace, it's going to take you longer than somebody who's going through the questions and exploring more things within the limited time. So make sure that your pace is at a good rate. Otherwise, it's going to take you longer. You need to be selective with your question. If you're asking non-essential questions, then you're going to take longer to elicit a history. The RCA is time limited. You don't have the luxury of asking all questions that you want. You need to be very selective and go with the essential questions. If there's some non-essential question, you don't have to ask them. Avoid repetitive questions. If you're asking repetitive question, you're just going in circle and you're not progressing, and it's going to take you longer. Excessive use of summary. If you're taking longer by summarizing and regurgitating back what the patient has told you, then you're not using that time to gather data. You're doing more of the talking, and that's going to take you longer to take a history. Another common trend I've seen is that registrars are requesting various examinations and various tests, and this is taking a long time in the history taking. So you're explaining all these tests and examination, and actually it does not really help you to score higher, because if you're arranging various tests, you're not being discriminate, then examiners will think that what's the reason you're arranging these tests. So make sure that you identify what exactly you're doing in data gathering that's actually causing you to take longer in history taking. So how do you compress data gathering? You need to sharpen your question. The quality of your question will help you to get better answer and progress the consultation. If you don't sharpen your questions, then you're likely to be asking a very trivial question that's not going to move the consultation forward. The next practical advice is to speed up your pace. A tip that I'll give you is to try and consult within 10 minutes as an experiment. Try to put a challenge on yourself and put a constraint of 10 minutes. By doing that, you're going to compel yourself to increase your pace. And if you're going to increase your pace within the 10-minute limit, then when you go back to 12 minutes, you're going to find that it's less stressful to consult within 12 minutes. So you need to also make sure that you don't summarize excessively, unless if it's really necessary, then you can summarize. And usually the summary needs to be succinct, just 2 lines if possible. If you're going to summarize the whole thing and take a minute or two, then it's going to actually delay your clinical management. Be selective of the examinations and investigation that you arrange. If you're not selective, you're discussing various things. If you don't commit to working diagnosis, then what happens is that you're not sure about what's going on and you want to ask more questions to make sure that you don't miss anything. And the time is ticking and you're not committing to working diagnosis. And then what happens is that you realize, I don't have much time, and then you just rush your clinical management. So make sure that you commit to working diagnosis. And this is very important because if you don't have a working diagnosis, your management is likely to be wishy-washy. This is very important to make sure that you sharpen your question. Let's analyze this consultation. Mary is a 32-year-old medical secretary. So she's been experiencing heavy menstrual bleeding over the past 6 months. So the doctor says, how can I help Mary? And the patient tells the doctor, my period has been getting heavier, I'm struggling with the bleeding, it's getting out of hand. If you're thinking about the questions that you're going to ask, what question will you select out of these 3? That's good that you put 2, because what happens is that if you ask, how long has this been going on? The patient would just say it's been ongoing for the past 6 months, but it's getting out of hand now. So you're not getting much information. If you just ask how many pads or tampons are you using, this is a closed question, and you're not likely to get a good story, which means that you might have to ask another question later to get to more information. Whereas if you ask a question like, how did it all start? Then you're giving the patient opportunity to tell you a little bit more about the narrative, and the patient starts telling you, it all started 6 months ago, the bleeding has been getting heavier to the point that I'm using 10 tampons a day. I used to have heavy bleeding first couple of days, but now it's all 6 days of my period. So do you see how the quality of your question will make your consultation progress? If you're asking the question that's how many pads or tampons are you using, then you're not likely to get a good data to progress your consultation. I'm not saying that it's not a good question to ask, but you need to know when to use open question and when to use closed question, and when exactly is it appropriate to ask such question. Having a structure is very important. If you don't have a structure, then you're going to find it very difficult to manage your time, because A, you're not going to be systematic in your approach. B, you don't know exactly where you are in the consultation. To keep up with time, the work starts before the consultation. You need to give yourself some time to prepare the case, to prime your case. Then when you start the consultation, what I usually do is I get the story out there, ask the patient a couple of open-ended questions, and then see what's going on in the story and pick up on cues by making sure I'm listening actively to what the patient is saying. Then I go over the red flags. I try and narrow down the working diagnosis. I elicit the patient's idea, concern, expectation, and also think about the patient as a person, not just a patient who's consulting. The patient has taken time out of their day to consult you because they're having a problem. It's likely that this problem is affecting their life in other aspects, for example, their work or their family. So think of the holistic approach where you're asking how this illness is impacting on their life. Then what you want to do next is to make sure that you are on the same page with your patient. After the 6 minutes where you've taken the history, then you need to make sure that you think about the management. How are you going to manage this case? So you need to make sure that around 7 minutes, you're readdressing the patient's idea, concern, expectation. You're achieving a shared understanding. And then you've explained the working diagnosis such that when it comes to discussing the treatment, then you're doing it without having to rush. Because if you're rushing it, then you are not likely to have a shared management where you're personalizing your treatment. You're more likely to give a generic plan to your patient if you're in a rush. It's important that you have a structure. This is a structure that I use. You can develop your own structure based on what you feel is natural for you. If you've made it this far, then I've got another video that I'm sure you're going to find useful. This is a video where a registrar who passed the RCA first attempt shows how she managed to get more cases. Click the video to watch it. Take care everybody. Bye bye.